I had an interesting experience the other day. So I just realized how big of a catastrophe mainstream medicine is. It's incredible. It's as if the pharmaceutical industry is telling them what to say to make more I'm sorry. It's like the pharmaceutical industry is telling them what to say to make more profit. So I went to I went to a psychiatrist or like psychologist for some anxiety or whatever, right? And I head there, and I don't really have anxiety. There's a long story that goes into it, but basically I went there, and the therapist was like a fat Egyptian guy, and I sit down, and he's like, within the first 5 minutes, I tell him, yeah, I have a bit of anxiety. I'm not sleeping that well, blah blah blah, and then he's this fat. Keep in mind, he's a fat 250-pound guy. I'm like an in shape, muscular type of guy. And I look healthy, and I'm smart. I have all those qualities, and I look pretty decent. And then he's sitting there, and he's like, I think I told him the slightest, symptoms I had, and then he says, well, I think I've been looking at your profile, and from what I'm seeing, you have some serious anxiety issues. Do you have depression? Do you have this? And I was like, not really, no, just a bit of anxiety before I sleep. And then he was like, well, what I'm going to do is I'm going to prescribe you this medication. He asked, before asking my diet, my exercise routine, my social relationships. Before any of that, he started prescribing medication, okay? So, and the irony is when I started being like, wait, aren't you going to talk about health, diet, other factors before? Aren't you going to be talking about like other things before prescribing like serious medication? Then he's like, okay, let me get one of my associates here. Then he brings this other old, 80-year-old doctor who looked like crap. You could tell he's also overweight to the moon. He looks fat. He's overweight, old guy, and he looks very unhealthy. Because you're old does not mean you're unhealthy, all right? That you're unhealthy because you do not take care of yourself the right way. There's a lot of older people who are very in shape, probably better shape than me, and I'm in my, early 30s. So he's like, this old guy gets on, and then literally within the first couple minutes of me talking, they're like, okay, we have a medication we think would work really well with you. And I was thinking to myself, Jesus Christ, it's like they're trying to, their goal is to sell medication. It's so weird. I don't know what it is, but they're pushing the medication so much. The mainstream medical society, community, mainstream, conventional medicine is very corrupt. I would say this, in my opinion. There's a lot of instances where I feel like I almost have the suspicion they're trying to depopulate the planet with their horrendous advice and their lack of good advice. They're not telling you, eat a particular way, exercise a particular way, sleep, sun is very important, get your vitamin D. So they're not telling you these things. They're telling you, okay, if you're having these symptoms, you should buy this medication. That's pretty much what they always say. So I think mainstream medicine is an absolute joke. It's a catastrophe. In America, it's horrible. In fact, there's so much politics and money behind what they're saying. There's so much nonsense behind what they're saying. And if you talk about diet, things like that, they will not be able to communicate with you on that. It's almost like they're told not to. They're never allowed to give health advice. This is what I've noticed. One of my family members is a doctor, and he told me that a lot of times doctors are shunned from being able to talk about diet, exercise, factors like that. They only seem to be able to prescribe medication, and so it's very corrupt. And I think I'd be very careful listening to mainstream medical advice. I'd also be very careful of taking a doctor's recommendations. They're usually wrong, for real. They're usually wrong. For instance, there's a doctor who told me, I told him I do carnivore. I eat pretty much only meat. And my blood work, actually, I got my blood work done, and it came back all the best it's ever been. All the best biomarkers, all the best numbers I've ever had in my life, okay? After eating meat pretty much exclusively with eggs for 6 months. Okay, so I go to this doctor, and he's like, well, she was telling me that she's like, my numbers have been really good. What have I been doing? And I told her, I'm just doing the carnivore diet. I pretty much eat just meat and eggs. And she was like looking at me. She was like, really? I was like, yeah. And then she's like, well, that meat is not good for your arteries, this and that. She started saying this nonsense, outdated bullcrap. These doctors are like with 1950s medical knowledge. Literally, the ones that you see in the hospital, they're with old ass medical knowledge, and they're telling you such BS. And so many people are getting unhealthy, sick, and dying because of it. I cannot be quiet about this issue. So, I would be very careful of trusting doctors. When you have like a cut on your leg and you need stitches, go to the doctor. But if you're trying to get, improve your, let's say you have some sort of illness like Hashimoto's or something like that, be careful. Be careful. I would say listen to people who are a little bit more aware of things. Like, for instance, Sean Baker is a great resource. Bart Kay is a great resource. Anthony Chaffee is a great resource. If you guys ask, I could put the names of these people in the description. You have Paul Saladino, which is a decent resource. But just be careful of listening to these doctors who have no clue about health. They have no clue about health. They're taught everything but how to be healthy, and they don't teach that to their patients. Just be careful with these people. They have they're stock full of bad advice as well. They're stock full of bad advice. My doctor, she was telling me, she was like, well, I'm noticing, your blood work showed that you're very healthy right now, blah, blah, blah. Let me check your lungs. She checked my lungs, very clear lungs, breathing well. She checked my thyroid, very good thyroid. Everything's functioning optimally. I'm feeling very good. I'm optimistic. I'm getting sunlight, so my vitamin D levels are good. Then she starts telling me, I'm having too much meat and this and that can result of it. And I was like, wait, but I've been doing this for 6 months and my blood work is the best it's ever been. I'm losing any sort of illness I had in the past. I'm getting healthier and I'm feeling good. Like, what do you mean? And then she says, what are you doing exactly? Explain to me. And I was like, yeah, I'm eating pretty much just primarily meat and eggs. That's pretty much all I eat. And I try to get good quality eggs, but with meat, with beef, pretty much beef. With beef, it doesn't matter that much if it's grass-fed or not. But I try to get just beef that tastes good. And I try to get eggs that are pasture-raised. That's it. And then she was like, what else are you doing? And I was like, sometimes I have blueberries. Sometimes I eat blueberries. Sometimes I have, some honey. Then she's like, so you're not really on carnivore. You're doing this and that. And I was like, yeah, but I have blueberries like once or twice a month. And I have honey like maybe once or twice. Yeah, again, once or twice a month. And then she was like, this is very interesting. So it just made sense. It just was a big indicator that she had no clue what she was talking about. She had no clue. She was a doctor who went to med school, who was taught incorrect information on health. And she had no clue what she was talking about. And I was kind of, she actually... she told me about this before. Like, I went to her and she was like trying to dismiss the carnivore diet like heavily, right? She was trying to say like, don't eat meat, it's going to clog your arteries, blah, 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 you're going to have a heart attack. And then I'm like, I come back a month later with my blood work done. Well, like a few months later with my blood work done. Best it's ever been. What I'm saying, guys, don't trust conventional doctors. They're idiots most of the time. Not idiots, but they're taught very incorrect information, and their job depends on them preaching that information to people and not telling them the truth of health and not telling them, updated, knowledge on health, accurate knowledge on health. They're not able to speak on that. They will lose their license. Look at Sean Baker. He lost his damn license because he was giving advice to his patients on how to get healthy, and they took his damn license. His license was revoked. So I think America's kind of like a depopulation agenda going on here. So what I'd say is just be careful of following these people and listen to people who have try to get your information from better resources. The names I mentioned are good people, and I'm a guy who's been studying health and fitness my whole life, so I think I have something to say. I've also experimented a lot. I tried paleo, I tried keto, The best diet I've ever done so far is pure 100% carnivore. Carnivore is amazing. It improves the way you look a lot too. Your skin, your hair, your teeth, your eyes become more white, more radiant. You feel more energetic. Your mental abilities are amazing when it happens. I'm in a train station right now, but anyways, thank you guys. I will keep posting stuff. All right, bye.